Welcome to Derm Clarity, Pore Decisions and Flake News. I'm Erica Ramos. I've spent over 21 years in healthcare. I'm a dermatology physician associate, doctorate of medical science, the founder of Restorascalp, and the host of this podcast. I'm here to help you make sense of your skin without the hype. Just a quick note before we dive in. This podcast is for education only. It's not medical advice, and it doesn't replace the care you receive from your own provider. My goal is simple, to help you understand what's happening with your skin, hair, and nails, so you can make informed, confident decisions alongside your care team. Today, I have the privilege of introducing someone I truly admire and have had the privilege of working for the past 4 years. Dr. Annabelle Garcia is a board-certified dermatologist and owner of Santerra Dermatology, where she leads a thriving practice. As a Master Allergan Injector, she is recognized for delivering natural, refined results while upholding the highest standards of patient safety and personalized care, helping patients feel confident, empowered, and their very best. It's truly an honor to work alongside her. I deeply admire the way she runs her practice with integrity, intention, and heart. Today, we're going to dive into the good, the bad, and the ugly of fillers, what they're meant to do, what can go wrong, and what happens when people take things a little too far. Let's get into it. Dr. Garcia, welcome to Derm Clarity.
Thank you. Thank you for having me.
So happy to have you here. For people that are listening that maybe haven't had a filler or want to know a little bit more about fillers, how would you talk to your patients about what fillers are?
So fillers are injectable. There's different types of injectables, the most common being hyaluronic acid, which are the most popular fillers in the sense that basically we're just restoring that volume that we've lost through the aging process. So all of us have hyaluronic acid in our skin, and we lose that starting in our late 20s, and essentially leading to volume loss, skin laxity. So we're restoring that volume through injectables or through fillers. There's different types. Hyaluronic acid is one of them. There's biostimulators as well, which are kind of in a different category, such as like calcium hydroxyapatite and polylactic acid, which are more biostimulators, but the HA fillers are the most common.
What should a patient expect? I think a lot of people get this in their mind of what, the duck lips and that I'm going to look way different and I'm not going to be myself. How should fillers well done look?
Well done fillers should look very natural. I'm a big proponent of natural, refreshed look. I think nowadays a lot of us are concerned about looking done or overfilled, and that definitely happens in our industry. And I think going to a skilled injector is very important, because if it's done tastefully and if it's injected properly, it can look very natural. I always tell my patients, you want to age gracefully. We're not trying to essentially turn back the clock years and years and years. You just want to look like a refreshed version of yourself.
Definitely. I had a patient the other day who came in thinking she wanted a lip flip. And so we did the lip flip, which of course is like a neurotoxin that we're just kind of, having the muscle change the contour of how the lip is. But when she came back in, she's like, I expected to be more full. And why do so many people, do you think, do they confuse what Botox does or neurotoxins do versus what filler is?
Correct. And that happens a lot. I think it's confusing because both are injectables. I think social media sometimes can portray these differently, and so it can become confusing. Botox, which is a neurotoxin, is injected directly into the muscles to soften that muscle so we can't contract when we're doing facial expressions. So it's all about relaxing or smoothing muscles, where filler is restoring volume to provide more structural support to restore the volume that we've lost through aging. So completely different, injected in different locations, but definitely patients get confused about that.
Yeah. So when you do get your neurotoxin, your Botox, your Xeomin, your Dysport, you're not adding volume.
It's very important to highlight. You're not adding volume like you would with an injectable filler. You're relaxing muscles. So, a lot of us don't like our 11s or our crow's feet. Like you mentioned, a lip flip. Botox can be injected to soften the jawline and the masseters and such. And so it's very different to relax muscles. And the more, it lasts about 3 to 4 months. Ideally, you want to keep up, because the more that muscle is relaxed, the less it's going to contract. and we don't want our muscles contracting, and we're trying to prevent wrinkles.
Yeah, that's a good point too. Now we bring it back to fillers. About how long do you think people should expect that their filler lasts?
So filler can last anywhere from 6 to 12 to 2 to 3 years. It depends on the location of the filler, where it's injected, if it's injected deeper on the bone or more intradermally. It also depends on the type of fillers. So HA fillers, fillers that go into, for example, the cheeks or the temple area can last 2 to 3 years, where usually filler around the mouth or in the lip area can last not as long. So, and everybody, we all metabolize filler a little differently. So I do have patients that get more than a year out of their filler and some patients that just metabolize it quicker. But probably a year or so is a good rule of thumb to expect that to last. And sometimes filler persists even longer. So there's not a set time frame, but it's definitely going to be a longer longevity versus a neurotoxin, which usually completely metabolizes in 3 to 4 months.
And you'll kind of notice when your filler isn't giving you that volume anymore, then people will usually come in asking for their filler again.
Yes, you can. I have patients that say, "Oh, I had full cheekbones and now I feel like my face is falling." And, as we get older, we lose collagen and elastin tissue. And that really takes a toll on our face because when we lose volume, it makes us look more tired, more aged. As we get older, we lose bone mass. So, a younger looking face, a 20-year-old, for example, has all the right proportions. And as we get older, as we lose muscle mass, we lose fat pads, we lose collagen, it definitely affects the aging process. So we're trying to restore that volume loss in, like we've talked about, in a natural, subtle way. And it can be done very tastefully if done in the hands of the right injector. And as you know, I'm big on being conservative. And sometimes starting slow is better than jumping in and doing a bunch of volume restoration all at once. And people typically don't want to look not like themselves. So I always tell patients just to be mindful. Sometimes we have to set boundaries as injectors and keep patients from overfilling.
Right.
But I'm all about looking at it through a process over time and an investment over time. We didn't age overnight. And so we're trying to restore that volume gradually over time. So we don't have that, oh my gosh, what did you do? What did you get? New cheeks? Did you get a new chin? Those are usually
Right. You
compliments
want
we
people to
don't
look
want.
at you and go, "Oh, you look so refreshed. Have you been sleeping better? What have you
Exactly.
done?" Rather than like, "Okay, I know she just got her cheeks done."
Right. Correct.
So on that note, how do we make sure that we make these fillers look natural?
Yes, and experience does matter when it comes to injectables. We, as doctors, we go through extensive medical training, go through med school, residency. I have been in practice for 15 years and the field keeps evolving. So staying on top of new techniques, new products, but knowing where to inject is key, and knowing how to manage complications is a big one too. I have patients that come to me that want to reverse their filler, or they're not happy, or they had an outcome they weren't satisfied with. And it's always important to know who's injecting your face and what you're injecting in your face.
Yep. And that it's not expired and that it came from a reputable source and
Absolutely.
all of that as well. So for any of those people out there on the fence, have been thinking about getting a filler for a really long time, what would you say that you really wish everybody knew before they walked in for their first filler appointment?
So I would love patients to know that it can be done tastefully, it can be subtle, and if injected properly, it can have beautiful natural results. Also, knowing that a lot of these fillers are reversible. I think that is, patients have a sense of security when they know that, okay, if I end up hating this, it's reversible. So we do have products. Fortunately, I don't have to use them very often, but there are products, hyaluronidase, that can dissolve hyaluronic acid filler. And I think that just makes patients feel a little more comfortable thinking that if it can be reversible. But again, when done tastefully and done right and injected properly, patients can be very satisfied.
I've heard from a patient personally. She said she's worried that if she overfills and then has dissolved, that she'll end up looking like she's like a saggy balloon. Have you heard that before? Like,
I
if you put all this
have.
volume, and I do get rid of it, or I do let you dissolve me, aren't I just gonna look saggy and baggy? What would you say?
And I'm in my practice, we take very detailed photos from every angle. And I think sometimes when we're investing in our face and we're excited about a new procedure and we're hyper analyzing everything, and then sometimes maybe you're like, I didn't have this line here, or I didn't have that line there. And then it ends up being we go back to the before photos and that was there before. So I think it's just photos are so important. And especially seeing that transformation slowly over time, like we said, in a gradual, graceful process. It's just that's a myth. I think sometimes people are thinking if I start injecting, I won't be able to stop, or I'm going to look worse off after. That is a myth. It's just that we tend to forget what we looked like before our procedures.
Yeah, it's really nice to have those before after photos. And I think I've also personally had people afraid or reluctant to get those photos beforehand.
Mhm.
And no, like that is only going in your chart. People aren't sharing your photos if you don't want them shared. And it
Correct.
really is that we can make sure that you're getting the best cosmetic outcome and you're not worried that maybe something went awry before or after your filler got done. So don't be afraid to let your injector take photos. Yeah.
Correct.
I think people really feel good about themselves when they have their filler done. You should do this because you want to, not because somebody forces you to or says you need it, and because you personally want to feel better about yourself.
I've had, it doesn't happen very often, but I have told patients, you know what, I know you're very anxious about this, sleep on it. None of these procedures should be rushed. You shouldn't feel pressure to do any of this. These are elective cosmetic procedures. And when I see a patient that's overly anxious, I want to make sure they're making the right decision. And
Mhm.
so it doesn't happen often, but I have had patients where I'm like, okay, go home, think about it. There's no pressure, no rush. And then, most of the time they end up coming back and end up being grateful for having that opportunity to really think about it. So I'm passionate about that. I'm passionate about doing what's right for patients. What's right for one patient isn't always right for for another patient. So just really having individualized treatment plans and making sure that we're all on board with wanting the same results and having the same expectations.
And if you're worried about it or you feel like you are pressured into getting a filler by an injector, ask for more information. There's all kinds of pamphlets out there too, so you can
Yep.
learn more. You don't have to just take it from that person's mouth. You can do there's so much information this day and age too. So if you don't feel comfortable, like like Dr. Garcia said, take a moment, look at everything yourself, ask for more information, and then come back when you feel comfortable, or go to an injector that does make you feel comfortable.
Absolutely.
Okay, so we wanted to also talk about the risks and the realities of filler, because no matter what we do to ourselves, there's always a risk. What would you say are the real risks for patients that you want them to understand about fillers?
So, most commonly, fillers, like we talked about, done safely, the common risks are mild bruising, tenderness, mild swelling, usually resolving in about a week or two, sometimes a little longer if done, for example, in the under eye area. That area can end up swelling a little longer. Now, a more severe risk could be vascular occlusion, where you're injecting the filler into an important blood vessel, supplying blood to an important part of the face, which can cause basically necrosis of the tissue of the skin, which is where the skin has vascular compromise. And that can lead to breakdown, ulceration, pain. And ultimately, if injected in the wrong place or even in an important vessel, it can lead to vision loss if you're doing it sometimes around the eyes in the glabella area, which is right here. So definitely there are risks. That's why it's so important to know the anatomy and make sure that your injector has proper training. But most of the time, side effects are mild and transient, and last just a few days to 1 to 2 weeks.
And if somebody recognizes that vascular occlusion quickly, hopefully there's not a whole lot of fallout from that. But again, that goes back to making sure you have a experienced injector and one who has that available and present in clinic just in case something does go wrong.
Definitely. Like those kinds of complications, you want to immediately treat due to you can have potential consequences from that vascular occlusion that you could reverse pretty quickly if you know how to recognize that.
Red flags would be looking like you don't have blood flow in a particular area, it turning colors and necrotic. So,
Correct, which we don't want.
which we don't want. That would be the bad. You kind of touched on it. It's very rare. How rare or how often do you think that these vascular occlusions actually occur? Is there data
I
on that or?
It's actually quite rare, especially there have been studies comparing needle injection versus cannula. The risk of vascular injection is much less with the cannula, which, I use both in my practice depending on where I'm injecting. Actually, microocclusions are more common. So there's tiny little blood vessels all over our face that if those get occluded, it's not as serious as a result or a complication as if a
Mhm.
major artery is injected. So that's why we go back to how important anatomy is, making sure, for example, around the mouth, there's important blood vessels that you don't want to inject. There's important blood vessels around the eye that lead into the retinal artery, which is the artery that supplies our eyes. And that occlusion there could lead to vision loss, which that would be a complete, like a devastating complication that nobody wants. But that's why
Yeah.
it's so important to know the anatomy and just know that these things can happen. They're actually a major occlusion, actually very, very rare, especially in the hands of an experienced injector, but they can happen.
For those of you that maybe have never had a filler who are listening, when a injector is injecting, they're also going to aspirate at certain areas that are, meaning they're going to pull back on the plunger and they're going to make sure that there's not blood in that area that they're about ready to inject. And that's kind of just double checking and making sure that they're not getting ready to inject into an area. So if you're worried about that vascular occlusion, like Dr. Garcia said, it's good to have an experienced injector because they know, okay, I'm maybe in a little bit more tricky area where I want to check that I'm not in a blood vessel. I'm going to pull back on that plunger real quick and make sure that there's no blood flow in that
Correct.
area. What's common questions that you get from patients?
I think common questions are, am I going to look like myself? Which, like we said, have done right.
Mhm.
Definitely. I think patients ask if it's reversible. I think that's reassuring to patients. I think something very important that patients need to ask their injectors is whether they can manage complications. Because as we know, there's injectors who do a weekend course and end up, maybe inject not having the experience that some of us do with these complications, and then it ends up being they can't manage that complication. So that does
Mhm.
happen, not very often, but it does happen in my practice where we manage complications from outside injectors. And I always tell patients, and then patients end up saying, oh, I should have done my research, or I should have done a little more background check on who's injecting you. But I think being able to manage a complication is important because complications do happen. And even in the hands of a skilled injector, a complication can happen, even though rare, but you want to know that that injector can handle that complication.
Yeah, and that could be a tricky thing to navigate. Like,
Yes.
you almost feel like maybe as the patient, you're almost questioning that provider. Do you have a good way that you think that they could assess?
I'm very transparent with my patients, and I think just asking, do you have hyaluronidase is very commonly used. If you're injecting hyaluronic acid, you should have the reversible agent, which is hyaluronidase, to reverse it in the office, ready to be injected if needed. So I think asking, do you have hyaluronidase? Have you ever had a complication where someone lost their vision? I think just being straightforward is important and feeling empowered to ask those questions because ultimately patient safety is what should be the most important. And I think knowledge is power.
It's your body, you're getting something injected into it. You're
Yes.
well within your right to ask, hey, do you have, you may not even remember the word hyaluronidase, but if you just ask, do you have this
The
stuff here just in case something goes wrong to dissolve it, then
correct.
maybe that's enough. Okay, so now the ugly, which is really what we've kind of been alluding to this whole time throughout the podcast, is overdone. And then there's also something out there where there's MRI studies that people have looked at and said, hey, this filler's in there way too long, and trying to kind of scare people about fillers being in their face. So I wanted to kind of go over all of that with you, Dr. Garcia, and get your thoughts on the ugly. of fillers?
So there's a lot of myths of filler that are just flat out myths. Yes, there was that viral thing that showed persistent filler after MRI imaging in patients years after injectables. Just because you can see it on MRI doesn't mean it's harmful to the patient. We've come a long way with imaging, and you can see little things in your skin through these very sophisticated imaging scans. So just because you see it in the tissue doesn't mean it's causing any harm. So I think that's important. Something else is I get a lot of questions on filler migration. If I inject here, is the filler going to end up? So filler migration is actually quite rare, and it's almost like dispersion of the filler over time. It's not like it's traveling from one area of the face to the other. It depends on where it's injected, how it's injected, what product is injected. And it's usually just subtle where it disperses differently than where it was first injected. So there's a lot of myths on filler migration that are incorrect. So I think that can be scary to patients. I think just knowing where we're getting our information from. The resources we have now, the internet is a very powerful tool, but it could have great information and it can have completely misleading information. So I think just knowing your source and trusting your injector as well, and knowing that they're qualified and trained to do fillers. It's definitely sometimes a hard battle with the TikTok trends of what truly is medically accurate and what is just a complete myth.
So for people that are sitting out there listening, maybe giving them an understanding of how our body processes the hyaluronic acid and how it breaks it down, and eventually our body kind of takes care of it anyway. Could you put that into like layman's terms on
Yes.
how our body processes these fillers?
So as we all, like I mentioned earlier, we all have hyaluronic acid in our bodies, and that those tissues get degraded over time through enzymes and just normal bodily processes. So the same way our hyaluronic acid gets broken down is very similar to how hyaluronic acid filler gets dissolved, where over time the body kind of eats it up and takes care of it and does its due diligence when it comes to just restoring, that tissue turnover. So that's a very normal process that goes on in different parts of the body.
Another thing I just thought of as we were talking was occasionally there'll be people who maybe have like a little immune reaction to their filler. Why does our body do that? And why might we see swelling occasionally 6 months later after a filler?
Yeah. So sometimes our immune system just doesn't like something that's foreign to our bodies. And even though we have hyaluronic acid in our bodies when we're injecting it, it is considered a foreign. It's not your own innate hyaluronic acid. So the body does incredible things sometimes, and you can form an immune response, especially if patients that are predisposed with autoimmune conditions can have different reactions where the body's trying to break down that filler and it's not doing so as efficiently as someone that doesn't have that immune response. So I think it's just always being careful about your taking a good history. Seen some, we saw it a lot with COVID, where patients that had the vaccine tended to be reactive and develop nodules after filler injection if the vaccine was injected within a month or so of their vaccine. And that somehow our immune system is triggered and forms almost this like attack on this foreign substance, if you may call it. And that's rare, but there are ways to manage that as well. So it doesn't mean that that's a permanent issue or a permanent damage to the tissue. Usually we can kind of trick the immune system in either if there's an infection or there's an autoimmune response to it to kind of trick and reverse that process.
Just calm it back down.
Yes.
Have you ever seen where it didn't calm back down, or for the most part,
no.
we're able to?
Yes, I had a very interesting case where I had a patient react to filler 2 to 3 years later, which is very, very rare. I had to call some experts that had like very rare cases of this. It can happen. The body, just everybody metabolizes and processes things differently. We were able to reverse that, but she had a strong history of autoimmune disease, which she already knew she had. So we knew we had to be cautious, and it was just when we did filler slowly over time, she developed that reaction. But that's actually quite rare. So patients, it's like anything. When you take a medication, there can be a potential outcome. But I think just always having safety in mind and making sure you have an experienced injector, but things can
Mhm.
happen. And as long as that injector can manage that complication, then you're in good hands.
Do you find that more people, when they're wanting to be overfilled, do you think it's a patient-driven thing, or do you think that there are some providers out there or some injectors out there who may be encouraging people to overfill for some reason?
I think it's both. I think as an injector, you need to know when to pump the brakes and say, okay, no more. And, that does happen. I'm very much a proponent of not overly filled lips. I think that's a trend that happened for a long time in our society. It just doesn't, sometimes those lips don't even fit a face patient's face proportions. So I think it could be driven by the patient or the injector. So I think it's important to be conservative, to set those boundaries and have someone can honestly tell you, okay, no more. This isn't fitting your face. But we do have to turn away patients sometimes and say, enough, you don't need any more lip filler, you don't need any more cheeks. But I think there's the other end injectors that do push that and do overfill patients. So I think it's a two-way street.
And then if you're the patient who does feel overfilled, you get done with something and you're like, this is not what I wanted. And keep in mind, you're going to have swelling afterwards, right?
Correct.
Especially lips. So your lips may actually not be overdone. You might just have your swelling. But if you get done and the swelling's all gone and you are overfilled and you don't like what happened, then at least with the hyaluronic acid ones, we can dissolve. Can you briefly, though, talk about the ones that can't be dissolved and when you would want to make the change to considering something like maybe Sculptra?
So there's different types of fillers that are more in the biostimulatory category, like Radiesse or Sculptra, where these fillers are semi-permanent in a way that they stimulate our own bodies to make collagen. So we stop making collagen in our late 20s, early 30s. So once we have that collagen, we're done. There's no more volume restoration and turnover of collagen. So there's turnover, but there's not new collagen. These fillers stimulate the body to make collagen to restore that volume loss that occurs with the aging process. So those are more permanent in the sense that once your body makes that collagen, it's really hard to undo that because it's your own. Radius is another product that's calcium based, so that can show up in imaging as well. And it's a little thicker. It persists longer in the tissue. So, and nodule formation can happen. It's rare, but there's ways to manage nodules as well. But doing it, again, anatomy is so important. Knowing the depth of injection, knowing where to inject, is so important because some of these aren't reversible.
Yeah. So just knowing that you feel comfortable, somebody that injects all the time is the one that's doing your fillers for you. Okay, I would like to do a little lightning round before we're done. Subtle lips or statement lips?
Subtle, 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 all the time.
Go big or go home, or less is more?
Less is more.
Most overrated area for filler?
Probably the nasolabial fold, because a lot of the time we get heavy in the lower face because of loss of volume in the mid face. So people tend to add more volume here, which sometimes the deficit is in the mid face. And by enhancing the mid face, you get improvement of the nasolabial fold. So I think that's a lot of patients come in and say, I want filler here. They actually don't really need it here. They need it more in the mid face where they've lost that volume.
I tell people you don't want to start looking like we're not supposed to look like monkeys. We don't want all that
Correct.
volume here in the front. Most underrated area for filler?
Probably the temples.
I was going to say the same thing. I'm glad you said
Yes,
that.
patients don't really come in and say my temples have atrophied or I've lost volume in my temples, but it's amazing how as we lose volume over time, our eyes can look more sunken, and just putting a little bit of filler in that area, which is a high risk area in terms of vascular occlusion and such. But if done well, it can really restore that refreshed appearance. And it's subtle, and it's the temple area. We have to not make sure we're not overfilling the cheeks and forgetting about the temple area, because then proportions don't look symmetric and normal.
And you told me once before, like, it's amazing how much filler your temples can suck up, though.
Yes.
Like,
yes. I call them little sinkholes.
yeah. Yeah. Okay. Biggest filler myth you hear?
Probably the migration, probably the filler migration, or once I start, I can't stop.
Mm-hmm. Yeah.
One or the other. I hear both a lot.
One filler trend you wish would disappear.
The overdone cheeks and the overdone lips. I had two. Yes, that
We'll give you.
overfilled pillow face trend.
I think we hit this one earlier, but your best compliment after filler, is it you look rested, or is it your filler looks great?
You look rested every time.
Yeah.
People shouldn't be able to pinpoint where you got injected.
One thing filler cannot fix, but people think that it can fix.
Texture. Skin texture is so important, and filler can't change skin texture. There's where, a good skincare routine plays a big role, laser treatments, microneedling, that sort of thing. But fillers really don't affect texture as much as.
Yeah. So if somebody's sitting on the fence between laser and filler, do you have them laser first, filler later?
Usually, yes. If their texture, if they have a lot of sun damage, they have skin laxity and textural irregularities, I do suggest laser before filler.
All right. Well, it was so nice having you on today. I think, was there anything we didn't cover that you'd like to say about fillers before we end this fabulous podcast?
I don't think so. I think we pretty much covered it.
Dr. Garcia, thank you so much for sharing your expertise today on the good, the bad, and the ugly of fillers. This has been Derm Clarity, Pore Decisions, and Flake News. If you've enjoyed this episode, be sure to listen, like, follow, and share, and I'd love for you to comment. Tell us, what's your biggest filler question? What's something you've seen on social media that made you nervous? Let's keep the conversation going. Fillers, when done thoughtfully and by a skilled hand, restore structure and volume safely. And when done right, they don't change your face, they support it. Thanks for listening. See you next time.